Good morning. Today's topic is neonatal resuscitation, part 1. Principles of neonatal resuscitation and preparation for birth. The contents are resuscitation, the risk factors, physiologic changes at birth, normal transition and abnormal transition, preterm babies at higher risk, and preparation for birth. Basic steps in neonatal resuscitation. At first, assessment of babies and routine care. Initial steps to stimulate the baby to breathe, ventilation with bag and mask, intubation and chest compression, and medicines. The assessment of babies and routine care, these are always needed things that should be done 100%. And initial steps to stimulate the baby to breathe and ventilation with bag and mask, these are needed less frequently, that should be 10%, and in 1% cases the intubation and chest compression and giving medicines that are done, that is rarely needed. The TABC of resuscitation: T means temperature, A means airway, B means breathing, and C means circulation. For temperature maintenance, dry the baby immediately and provide warmth. For airway clearance, positioning should be done and airway should be clear if required. And for breathing, baby should be stimulated by tactile stimulation. And for circulation, assess heart rate and give resuscitation. The risk factors associated with the need for resuscitation: maternal risk factor before birth, preeclampsia and eclampsia, bleeding in second or third trimester, premature rupture of membranes, post or preterm gestation, maternal diabetes, and others. Risk factor during labor: prolonged labor greater than 24 hours, meconium stained amniotic fluid, fetal bradycardia, that means slowing of heart rate, prolapsed cord, cesarean section, forceps delivery, breech and or other abnormal presentation, and other. Blood flow before delivery: lung blood vessels are constricted, blood flow in the lungs is minimal, blood flow is diverted across the ductus arteriosus, and oxygenation occurs through placenta. Changes in lungs at birth: lungs fill with air, fetal lung fluid leaves alveoli, fluid replaced by air in alveoli. Blood flow changes at birth: umbilical cord clamped, increased oxygen in alveoli, blood vessels in the lung tissue relax, blood flow in the lungs increases, blood oxygen levels rise, ductus arteriosus begins to close, blood flows through lungs to pick up oxygen. Normal transition: term no meconium, breathing or crying, good muscle tone. Abnormal transition: gasping, ineffective or no breathing, often with poor muscle tone and central cyanosis, needs assisted ventilation, give oxygen if available. Preterm babies at higher risk: immature lungs, increased respiratory distress, increased heat loss and poor temperature control, possible infection, prone to bleeding in the brain, feeding problems. Key to successful resuscitation: at first, anticipation, then preparation, call for help, document or record. First, be gentle, provide warmth and mental hygiene. Preparation for birth. Prepare personal. Preparation in the delivery room. Test the function of equipments. Test the function of bag and mask. Prepare personnel. Birth attendant identifies a helper and explain roles. Prepare personnel. Birth attendant describes emergency plan. Make arrangements for calling a doctor or another person skilled in resuscitation or to shift the baby to the nearest neonatal referral unit in case of emergency. In prepare personnel, in preparation of personnel, there is an important step, that is hand washing. Wash hands for 2 minutes following 6 steps of hand washing. At first, palm to palm, that cleans palm and finger, then back of hands, then fingers and knuckles, then thumb, then fingertips, and then wrist and forearms. Preparation in delivery room. Some topics it is important and also essential. At first, a draft free warm room with temperature greater than or equal to 25 degrees centigrade. A clean, dry and warm delivery surface. A radiant warmer or overhead lamp. 2 clean warm towel or clothes. A folded piece of clothes half to 1 inch thick. A newborn size self-inflated bag. Infant mask in 2 sizes, size 1 for normal weight baby and 0 for small baby. A suction device, oxygen if available, a clock with second hand. Test the function of equipments. Before birth, check that all equipment and supplies are available and are in working condition. For warm environment, you have to switch on radiant warmer or overhead lamp at least half hour before anticipated time of delivery. Close the windows and switch off fan to prevent drafts of air. Test the functions of bag and mask. Pressure against your hand. Pressure release valve opens. Check that the bag inflates quickly. When we test the function of bag and mask, we give pressure against our hand and see that if there is any leakage or not. And we also see that pressure release valve open or not, and we also check that the bag reinflates quickly or not. If reinflates quickly, it is in good condition, or and if the bag is not reinflates, on that time we discard this bag. Next part is neonatal resuscitation part 2. Thank you.